All right, so we're going to continue on with our deep tissue demos. So we are doing procedure number 21, which is going to be the abdominal compressions. So we're going to make a series of compressions to release the abdominals, very similar to what we do in our circulatory class, but this time maybe instead of using palms, use fingers. The intention of this work is to make contact because we're going to start working on the structures deeper into the, for example, the psoas. So we want to begin to make contact. We want to start to assess their sensitivity, and we're going to start to create a rhythm to get them in a nice relaxing state. So working with their breath, undrape. And just like circ, we can think of it like a clock starting always on the right side. I usually like to start just above that would be his right side, his right as is, so I guess that would be 6, 7, 8 o'clock-ish. And working with their breath, as he exhales, I'm going to slowly sink. One breath, I'm going to let him take a breath in. And then as he exhales, I'm going to sink a little further. And then finally, this third, and I sunk down to the level where I feel a little resistance, and now I'm just going to hold it for 3 of his breaths. We really want to work with breath when it comes to the abdominals because this is a very vulnerable place as is. So to create a rhythm, they can kind of tell you how deep you're going without even speaking, because their breath will change. If you're already feeling deep, their breath will become a little bit more shallow and not as deep. So it usually takes me 2 breaths to come out. And then I'm just going to move to about 9 o'clock. I'll do one more. There's 1, 2, 3. Don't be afraid to play with pressure when you're beginning your compressions. We have to get pretty deep in a moment, so we're going to begin to get to that underlying structure with our simple compressions. So now I'm going to let him push me out. 1, because I held it for 3 breaths, and then I'm going to let him push me out. And if you create that rhythm, they know that you're taking 3 breaths to go deep, you're holding it for 3 breaths, and then you're releasing with 2 to 3 breaths, so they know if they can go deeper themselves or not. So there's 3, and I'm pretty deep. I'm good second knuckle deep. 1, holding it for 3. This is number 2. And this is number 3. And then I'm just let him breathe me on out. So we would continue that series of compressions all around the abdomen. As many as you can do, maybe a 12, a 2, a 3, that would be 4, 5, back to a 6. That's also the thing when it comes to our circ, sometimes we just kind of go right beneath the belly button, but we need to be a little bit more detailed now. And you don't be afraid to kind of feel the top of the pubic bone, which is pretty much a lot lower in the belly, underneath the belly button than we're normally used to working. So don't be afraid to feel the top of the pubic bone, and do your last set of compressions down pretty low, just above the pubic bone. And really get comfortable and confident. And also when you get to the lateral side, or the opposite side, the left side, this is where the descending colon goes down. And the job of the descending colon, which is the large intestine, is to take all of the water from our food and makes our fecal matter. So sometimes they might be a little bit more sensitive on this side, because by that time it's reached there, the water has been all taken out, and we have fecal matter inside there. So if they say it's a little bit more sensitive, lighten up your pressure a little bit, and that could be the reason. So that was procedure number 21. Number 22, the rectus abdominis. The rectus abdominis is kind of like the erector spinae on the anterior side of our body. And it's the 6-pack muscle. When you see the 6-pack muscle, that's the rectus abdominis. So we're going to make a series of compressions lateral to the rectus abdominis, and our intention here is to be able to kind of lift the rectus abdominis and loosen it up so we can get to the structure underneath, which is the psoas. So if you're not sure where the rectus abdominis is, which on most cases you won't be, You can ask them, would you mind doing a small little sit-up for me? And go ahead and relax. And then you can feel that edge of that muscle. So you can go from the ribs all the way down to the pubis. You can start anywhere you like. You can start in the middle and go down. You can start in the middle and go up, bottom to the top, up to you. But we're going to kind of come in at a diagonal to try to soften that rectus abdominis on its edges. The same rhythm, 3 breaths to go in. We're holding it for 3 breaths. Sounds like I'm saying breast, but I mean I'm saying breath. You don't hold 3 breaths. So he's got 1 more breath. And then we're going to slowly exit just like before. So I am using supported fingers. I can also use supported thumbs. I can kind of pull the rectus abdominis into my thumbs and do that same kind of down. My vector is down towards the table, and then a little bit of a lateral or a little bit of a diagonal vector to kind of try to get underneath it. Oh, we had a little release. We saw a little flinch. I like that. It's a good sign. So you can see that working with their breath, this series of compressions can take a very, very long time. And especially if they're breathing deep, that means we're doing our job well and they're in a parasympathetic state. So we would continue our compressions all the way up to just beneath the rib cage would probably be my last compression, and just above the pubic bone would be my last compression down below. So I would do my series of compressions up one side, then I'd go to the other side, and I'd also do my series of compressions. And then I would grasp and lift the rectus abdominis. So what that means, I'm going to start with my palm, and we'll see if this works. So I didn't spend very much time doing both sides, but we're going to press on one side of the rectus abdominis and pull on the other. Just trying to get, you can see this other edge here of his rectus abdominis. And don't be afraid to ask them to do a slight sit-up. Everybody has a rectus abdominis. Some people are like, I don't have stomach muscles. Everybody does. You will feel it. So I'm just doing a slight rock back and forth because what I'm trying to do is get a little grip. I'm going to switch to a thumb of both sides of this muscle so I can begin to lift it up. When this was done for me, inside my body it felt like that's what I felt like inside. So you can see it's kind of lifting up on this underlying structure underneath. It can be very, very relieving. It seems kind of funky, but it's actually kind of feels kind of cool when it's done right, I think. Elijah, what do you think? Is it all right? That was a good so. This is a spot working on their body on anywhere in the abdominals. We have to really start to show our confidence. So he's a little tighter down here. We have to really show our confidence because it's a very vulnerable position for anybody to be in. So if we're coming in confident and someone's allowing us to work inside their abdominal cavity, their abdominal area, that's a good relationship that you're forming. So he's a little more stuck here. I could spend a little bit more time trying to loosen it up to get a little lower, but you get the gist of what we're trying to do. And we're doing all of this because we want to try to lift this up, because now underneath, from about L1 to about L5, is the psoas. And the psoas is the main hip flexor. So when people talk about a hip flexor, they don't even know. This is all considered the hip. Your psoas is your main hip flexor. So and that lies deep to the rectus abdominis, all the way on the transverse process in the body of the vertebrae. So it's pretty deep. So how we're going to work with that, procedure number 23, we're going to compress into the psoas, asking for femur flexion, And we're going to compress laterally to the rectus abdominis and deep to the rectus abdominis. So when I say lateral flexion, I usually have my client, would you mind lifting your knee for me? And you can just rest your foot on the table, just bend your knee. I usually have my client bend their knee. And how I begin the psoas work is find their as is. Find the belly button and see the diagonal line in between the two. And then just come to that lateral side of the rectus abdominis, right about the middle of your little line. And we're going to begin to push down, just like we did our compressions before, with 3 breaths. And hopefully that will get us just to the very top surface of the psoas. And how I know if I'm on the psoas, one more breath, is I'll ask them, would you mind lifting your knee towards the ceiling for me? Go ahead and release. I'm not quite on it. I might need to go a little bit more lateral. And go ahead and lift your knee again for me. Okay, thank you. Now when he lifts his knee, I can feel that psoas contract underneath my fingers, and it almost feels like a rope. So as soon as I get it, now I'm on top of it, so now I have to sink even further with my 3 breaths down into the psoas muscles, supported fingers. This is where I really want to watch breath because it can be very sensitive. I'm kind of trying to touch his spine through his stomach. So this is the importance of also creating that rhythm so they know that you're not just going to jab in there, that you're slowly going to move in because you just spent all that time doing that with all the other 2 muscles. So he's got one more breath. And then I'm going to let him breathe me out. And from here, we're just going to work our way down the psoas. It actually inserts onto the lesser trochanter of the femur. So it's going to go down in a straight line until I kind of get to the groin area. And as I usually move down, it usually gets thicker, or I should say more noticeable for me. Go ahead and lift your knee for me. Okay, go ahead and relax. Another little thought is sometimes when you're right on top of it and you ask them to lift their knee, they'll barely lift their knee because you're right on it, and then they know if they lift their knee a lot, it's going to be painful for them. So that's another sign that I know. I can still feel the muscle contract, but that's another sign I know that I'm really close or I'm right on it. So I got one more compression. So I went down with my 3, had that knee flexion, and now I went 3 more to be into that psoas. Straight down towards that table with a little bit of a diagonal towards the vertebrae, and a little bit of a vector towards his femur. Go ahead and bring your knee down. So now as we go down, I usually, if I'm working on, especially male clients, I usually ask them to keep their chonies, their underwear on, just to kind of keep themselves contained. But I also don't have a problem with asking a male to adjust themselves because I'm going to start working very medially because the psoas comes down like so. So working down into the, he's got his underwear on, so do you mind if I bring the sheet down? Okay. So just so you can see where I'm working, we started our compressions down, and we're just going to move down into that groin area. This is also why you might want to, when you do your first set of compressions, start working just above that pubic bone because we're getting pretty personal. But we still want to be professional and polite. And can you just bring your leg up a little bit for me? Just to feel that. Okay, relax. Is that pressure okay? Sometimes when I ask for the femur flexion, or the leg to come up, this is femur flexion. I can feel the whole muscle because I can feel the whole thing tighten, so I almost know exactly where to go for my next compression. But if you don't know, ask for femur flexion every single time. It's totally okay, because if you're going to be poking around in someone's stomach, you want to make sure you're in the right spot. It just feels more confident for both of you. So I'm going to make my compressions a little bit further apart just for time's sake. But I would do maybe a compression here and a compression here. we want to avoid the inguinal ligament. The inguinal ligament, the very bottom of it, is that wire that you kind of feel at the very bottom of your groin area, which is attaching the two bones. So you want to make sure you don't hit that, that's the ligament, not the muscle. And it comes up at a diagonal. So we would finish the series of compressions all the way down for the psoas. Take your time. This is a very sensitive muscle that takes a lot of confidence to work on. So the more that you breathe into your work and you allow your client to breathe into their work, the more confident you're both going to feel. And you're going to have huge results and really good relief. So procedure number 24, the iliacus. Even though these procedures are 21 through 24, I consider them all within the same. I do all of these things whenever I'm going to work on the psoas or the iliacus. So, iliacus. Iliacus lines the iliac fossa on the inside of the ilium, and the psoas comes down from the lumbar vertebrae. They both attach to the lesser trochanter, the femur. So sometimes you hear this word called iliopsoas because they come and become one. But we have the psoas and the iliacus, which creates the iliopsoas. So we're going to work on the iliacus part of the iliopsoas now. So coming to the as is, I'm going to bring his waistband a little higher so you can see here's his as is. We're just going to slowly, like we're on the top of a mountain, slide down the slope. This is a sensitive muscle. Take your time. There's a huge sheath of fascia over this muscle that we have to slowly melt through to even begin to access the muscle. My vector is going straight down with a slight vector towards that inside of that femur, towards that greater trochanter. This might take more than 3 breaths. This one's going to take patience. Supported fingers. If you need more pressure, get better into your stance so you can lean from your back foot into your work. And we're just going to keep on moving down that inside. And you'll feel the bone. Just roll off the bone, the inside of that ilium. Sometimes this is really sensitive, not sometimes, this is a really sensitive muscle, and sometimes it takes people a little warming up to get to work this for very long periods of time. So sometimes in my first session working psoas and iliacus, especially iliacus, I might just do a few compressions before I really get into it, and then they have a little introduction of what to expect for the next time. So I'll just do another compression here. And then now we're kind of starting to run into where we already were when we did the psoas, where it becomes the iliopsoas. And I can do another set all the way back down if I'd like. One other option to do the iliacus is across the table. So let me just bring this down so we can see his as is here. Here's his as is. So another way to do it, especially, this sometimes is much easier, is to kind of bring him towards me and slowly shift my weight into that iliacus from across the table. If this was a wider person, I might have them scoot closer to me so I didn't have to reach so far across the table. So I never have a problem asking somebody to kind of come closer to me when I have to work across the table if I can't reach. I don't know if anybody saw that little muscle release that he just had. Even though it wasn't in the muscle I'm working on, that's still a sign. It shows us that it's all connected. This sometimes feels like I can get it a little bit deeper. So I like working the iliacus from across the body a lot. And I'll just do one more compression with that. But try it. Try either way. See what you think. See what your client thinks. One might be more comfortable than the other. And it's really about the comfort of the client. But if you're comfortable, they'll be comfortable. And I'll let him take one more breath. Sink a little deeper. You can make small little circles to really bring circulation and stir up that fascia, really melt it well. And when I say small circles, I'm not digging around. I'm keeping the same spot of pressure, and I'm just making small circles and exploring that area right around me. Small, small circles, not digging, small circles. So that is our series of work for the abdominals, specifically psoas and iliacus, the iliopsoas.